As Bessel van der Kolk so famously put it, the body keeps the score, the title of his seminal work. A great book, recommended. Indeed, the reservoir, the repository of your trauma, your abuse, your pain, your hurt, the uncertainty, the intermittent reinforcement, the unpredictability, the terror, the shocks, all these don't go away. They reside within your body, and they transform your body in ways which are sometimes counterintuitive. They render your body an enemy. They estrange you from your body. You feel alienated, as if this body that you have inhabited, sometimes for decades, is no longer familiar to you. And this is the topic of today's video. The video is divided in three parts. These are actually three different videos. The first video, the first part, is a general introduction to somatization. The second part is how narcissistic abuse specifically impacts your body. And the third part is a summary with some additional insights. It's much shorter. So visit any part of the video that fits you and get to know your body under the duress and the distress of narcissistic abuse, the most egregious and extreme form of maltreatment known to humanity. My name is Sam Vaknin. I'm the author of Malignant Self-Love, Narcissism Revisited, the first book ever on narcissistic abuse. I'm also a professor of psychology. Before we proceed, to remind you, I'm giving a seminar for 3 days about scientific, evidence-based ways to heal and recover from narcissistic abuse, all kinds of techniques and practices. 3 whole days, free of charge. All you have to do is be there physically. Now, there's a link in the description of the video. Click on the link and you will have all the details, where, when, how, etc., etc. If you have any queries or any questions, the link also leads to my email addresses, and feel free to write to me. I promise to respond for a change. Okay, Shoshanim, Shoshanot, Kidim, Kiddos and Kidettes, let's delve right into your bodies. As I said, the first part of the video is a general introduction to what is known as somatic symptoms or somatization. The second part deals with narcissistic abuse, specifically with and describes all the impacts and effects that narcissistic abuse has on your body. Generally speaking, we can divide the impacts of trauma and abuse in its various forms, and definitely the impacts of narcissistic abuse, in 2 parts: sleep disorders and somatic symptoms. Sleep disorders, as the name implies, is when you're having difficulties with sleep. You may oversleep, actually. You may be ravaged by insomnia. Whichever the case may be, sleep, in sleep or in the absence of sleep, your trauma and abuse try to manifest somehow, to express themselves. But this is not the topic of today's video. The topic of today's video is the rest of your body, apart from the sleep system. Somatization. According to the American Psychological Association dictionary, somatization is the expression of psychological disturbance in physical bodily symptoms. The first use of the word has controversially been attributed to Viennese psychoanalyst Wilhelm Stekel to describe what is now called conversion. I'll discuss conversion disorder or conversion symptoms in a minute. Some investigators, continues the dictionary, use the word in reference not only to the physical symptoms that occur in almost every type of anxiety disorder, but also to the expression of symptoms in such psychosomatic disorders as psychogenic asthma and peptic ulcers. Now, I'm not going to discuss psychosomatic disorders in this video because they are not reactive. They are not the outcomes of abuse. They have a different etiology. Somatization disorder, however, is often the result or the consequence of extreme anxiety, extreme tension, stress, duress, distress, and therefore has a place in this video. Again, we revert to the Dictionary of the American Psychological Association, which defines somatization disorder this way. In the text revision of the fourth edition of the Diagnostic and Statistical Manual, the DSM, a somatoform disorder involving a history of multiple physical symptoms, at least 8, one of which must be a pseudoneurological symptom, of several years' duration, for which medical attention has been sought, but which are apparently not due to any physical disorder or to the effects of a substance, such as a medication. The complaints are often described in vague, yet colorful or exaggerated terms by the patient, who often appears anxious or depressed. Among the common complaints are feelings of sickliness, difficulty in swallowing or walking, malaise, blurred vision, abdominal pain, nausea, diarrhea, painful or irregular menstruation, sexual indifference, painful intercourse, pain in the back or joints, shortness of breath, palpitations, heart palpitations, and chest pain. Somatization disorder was eliminated from the 5th edition of the Diagnostic and Statistical Manual and was superseded by somatic symptom disorder, which is defined this way. Somatic symptom disorder is a disorder characterized by one or more significant bodily symptoms, for example, pain, that cause distress or impair